Thanks.
Hello, and welcome to another episode of the Missing Piece of Support Group Life After Loss series. I'm Jamilah Robinson, founder and executive director for Missing Piece of Support Group, as well as your host. And today we are joined by Dr. Sarah Berg. She is the founder of Selfority. Am I pronouncing that right?
You are.
Awesome. So 40 is a doctor-led menopause education platform that helps demystify a lot of either myths or symptoms that we have going on in our bodies during this pivotal transition in many women's lives. And first off, let me thank you for doing that and providing the education in an era where, there's tons of education, right? But no one ever really knows what to believe. So for you to be an OB-GYN, taking a lead in clarifying some things for women, it's a huge plus.
Thank you.
Sarah and I met through a colleague, and what was it that we participated in? I don't want to call it a cohort.
It was a round table.
It was a roundtable discussion
Yes.
concerning women's health and the challenges that women have, either as patients and as providers. A very interesting conversation, very meaningful participants that were brought to the table for the discussion. I think we all left feeling a little bit better about how to move forward and the connections that we had made that day. Would you agree?
No, absolutely. I think that the most interesting thing I got out of it was the people. Like, I love talking with these people that I had not met before. And just literally, it was like bouncing off of each other and being like, yes, that, more. Like, we can. And it was almost like a power group, I felt like.
Yes, yes, we were so aligned in so many things, and to hear the words come out of other women's mouths, it was just reassuring that you
Yes.
weren't alone in that feeling, that sentiment, that struggle, your journey.
No, and that's what I think is the most powerful thing is not feeling alone. And I feel like that's the root of a lot of women's health is they feel so isolated, alone, and like they shouldn't feel the way they do, which is my personal reason for doing what I do.
Yes, and, a lot of that aligns with the feelings that we experience even, in pregnancy loss. So this conversation that we'll have with Sarah is going to be multi-layered because Dr. Berg has also experienced pregnancy loss.
Mhm.
So, we're just gonna take a dive into both sides of the spectrum of healthcare as well as, her journey with that experience. So
And I think an important part of it is that you can't separate the two. Your life and your work, you're still the same person within them both. So this happening with me as a physician that worked in the field versus this happening to someone that, had to go into an office a couple weeks later, like they're the same, but they're just different perspectives of the same.
totally agree. So, Sarah, what inspired you to move beyond the exam room and create a platform that focuses on educating women about their health first and foremost?
So I created self, and I know it sounds when you push it together, it's kind of like, am I saying it right? But I always say pulling it apart is the why behind it. So it's yourself and it's priority. And the root of it is that it's prioritizing yourself, and women don't do that. And I always say this is my line is like, I ask you to put yourself at the top of your list, but truthfully, the least of putting yourself on the list because we often deprioritize ourselves and put ourselves not even on the list. We're like, if everything else gets done, then we take care of ourselves. And the root of what I do, and from seeing thousands of women speaking the language of aloneness and deprioritizing and I always called it the four sacred walls because people could tell me things and know that this was a special place that we could talk and they didn't have to bring it outside of that room. But it was almost like a focus group day after day, seeing 35 people a day saying the same thing.
Yeah,
They were saying, I don't know this. I feel silly that I don't know about myself, even though no one taught me about it. I feel alone. I feel isolated. I feel like this isn't happening to anyone else because I also feel shame about saying out loud what is going on with me.
yes,
And this is in every level of women's health that I was seeing this. And so I was feeling like I was hopefully helping change lives one at a time, but I was like, this is a problem that needs a bigger answer. I need to catch these women before they enter the exam room So they don't feel alone. So they don't feel isolated. So they feel there's a community and a space to talk about things. And by me saying it to them, they can be like, oh, wow, this is so common that she has the words language for it before it even comes out of my mouth. And I feel like that speaks a lot for women because of that feeling. Again, shame alone. They're not going to talk about it. They're not going to bring it up because they deprioritize themselves. So my whole goal was to find a better avenue, a bigger platform to tell women how to educate themselves on their bodies and then not feel shame and bad about the fact that they didn't know it, and how to advocate for themselves in those rooms so they always could get the care they deserved. And it's not because the physician didn't want to, it's because the language mismatch wasn't there. And
Absolutely.
so when you have the language to bring it in, you're going to have a more productive experience. And we know since healthcare has made it where doctors only are allowed like 15 minutes with you, that you're getting the most of it and they're able to give you what they want to so that you don't feel like you're like fighting to get what you need.
Absolutely. And you brought up something really key is terminology and language. A person that is not a practitioner isn't going to know the language to use. So for you to introduce it in a way that you can compare it to what you are experiencing is so empowering. It's
Yes.
very empowering. And it's almost like you can prepare yourself for the appointment and the visit to have a conversation about what's going on. So thank you for clarifying your why. That's very helpful and inspiring. Let's dive a little bit into your loss story. Love to hear about your personal journey. Can you share the story of the baby you lost and what that season of life looked like for you?
Absolutely. And it was actually twins. So I lost
Mm.
twins. And so my story roots back a little before because I was, as many women now are dealing with, an infertility patient. And I was an infertility patient while I was a resident, which means I was training specifically in obstetrics and gynecology. So I was rotating with these physicians and then going and being the person that needed their help as well. And so it was a weird experience of literally following them around in a clinic and then sitting on the table of the clinic and being on both sides. So this was a pregnancy I worked for, almost like I worked for everything, medical school, everything. It was effort. It was
Yeah.
not the whoops, this happened. And there's no difference because no matter what, after you're pregnant, there's that connection, but mine was the work for it story. I threw myself into it. I put money and time and experience and had to like figure out ways around my work schedule to make that happen. So when it happened, it was joyful, but almost a little scary because, the twin pregnancy, I already had that fear in my head. Oh,
Mhm.
this is a little bit more high risk. And I had this fear in my head that if I make it through the first 14 weeks, everything will be okay. But I had a hard time like letting myself connect before that because I was so fearful. And
Yeah.
then after 14 weeks, when I was in the second trimester, I almost like everything. I was like, now this is easy street. Now I'm just, I'm pregnant. I'm staying pregnant. Even
Mhm.
though it's twins, I'm 4'11". So twin pregnancy on me, everybody was like, "Whoa, where are we gonna put these children?" I was like, "No, it's fine. I passed 14 weeks, everything's good." So I was, obviously in training, working 100-hour weeks, trying to care for myself, but still the priority was always like making sure that I did everything right so that when I had the kids, I was at a good step away point so I could take my 5 weeks off because that's what I was allowed. And so a couple weeks before it was my anatomy scan time, I was on night floats. And night floats is when you work go into the hospital at 5 p.m. and you leave at 9 a.m. and you do that the whole week. And then you got weekends off, but it was like that was the only rotation where you got weekends off. But it made it hard to schedule appointments because it was like an awkward timing. So I actually didn't go into my anatomy scan, that 20-week scan, until I was 22 weeks. And
Oh.
at that point, I was like, again, I thought I was on easy street. I just was trying to be as good a resident as I could
Mhm.
and like carry through. But also because I had past that 14-week point, for me, that was when I allowed myself to think good things were going to happen. And so I had already started, like, I knew my babies. Like, I had had vivid dreams about what they looked like. I had a vision of their 5-year-old, their 10-year-old, their 18-year-old selves. One was a girl and one was a boy, Brooke and Hunter. And
Mhm.
Hunter was gonna have my husband's strong jaw, and Brooke was gonna have my hair, and, like, I saw that. I know them. I knew them. So, it was just an exciting time to see them. It wasn't something I was anxious about. So, when 22 weeks hit around, I was at the end of my 5 days in a row of, that weird schedule. I literally walked from the hospital to the clinic where the ultrasound was, and my husband met me there because I was like, "You really should be there. This is kind of a fun one. You'll get to see the babies." We get there and I have the appointment with the sonographer comes in first, the person that ultrasounds you, and she's chatting and we're having a good time. And then all of a sudden she gets quieter, quieter, quieter.
Mm,
And my husband doesn't know that that's a scary thing, that when
right.
the chatter slows down and so he's still having his conversation and I'm thinking, "Oh, no, no, no." And then she leaves kind of briskly and the high risk doctor comes in and he starts scanning me. And this is my, like, not my colleague. He was my teacher. He was one of the highest in the field and he's telling me things that I know from a doctor side, but I didn't know from, like, it was the mom side of my brain was like processing and they were separate.
Right.
And what he was telling me was my daughter was doing great. She was perfect. Everything was growing well, but my son was severely what's called IUGR or very small, which means he wasn't getting the nutrients from me he needed. And
Mhm.
there I goes a woman blaming myself. Wasn't getting the nutrients from the placenta that was made, and that was making it hard for him to grow. And he was so growth restricted that he was very concerned. And when you hear a high risk specialist say very concerned, I lost it. I knew something was seriously wrong. My husband was still kind of confused because he's not in the medical field, but I lost it. And literally, I go home and I have a weekend in bed. Like, blessedly, I had that weekend off. I always say I watched Parenthood, which is my crying show, so that I could cry. And my husband started researching articles, trying to figure out a way where this wasn't a scary or bad thing. And so then I had to rally. Night, I get up, I go to work, and I have to pretend like everything's okay because that's what residency is. You just pretend. And so I went and had a shift and thought, okay, I'm just going to have to deal with this and do whatever they tell me to do. I can't change what's happening right now, but I have to go to work because that's the mentality. I go home from that first shift, I get in bed, I fall asleep, and an hour later, I wake up soaked. And I did the thing that a lot of women do. I'm like, I peed on myself. I peed all over myself. That must have been it. I go to the bathroom. I put a towel around me because that's how much was flowing out of me. I wore like a sumo rag. And then I called my doctor and said, I think I broke my water,
Yeah.
which obviously wasn't the case. I had absolutely broken my water, but there I was, minimizing and second guessing and even knowing what I know, like making it smaller.
Yeah.
And so my husband came home from work. He was working. I was in Houston residency. So I was in the medical center and we lived near there because I had to go in. My hours were so crazy. My husband worked in Kima, which is, 45 minutes to an hour away, depending on traffic. So he drove back up, got in the car. We go drive right back to the hospital I had just left, right up the elevator I ride every day, knock on the door of the triage that I had literally left 3 hours before as a physician. They
Mhm.
put me in trying to hide me, they put me in what's kind of was the storage triage room where all the boxes were. So,
Mhm.
surrounded by the boxes, they put me on the monitors, my doctor comes in and she's like, "Yeah, you broke your bag of water." One bag is still intact because they had their separate bags, but Hunter, the one that had the scariness, his bag of water's broken. And, you know, I moved to a room. I'm not viable because right then at that time when this happened, 22 weeks was not considered a time when they can do the resuscitation. They keep my baby alive. So I wasn't where they were doing anything to actively prepare me for labor. They had to say, hey, this is a watchful waiting. We'll see what happens. And then 36 hours later, he was born. And he was born still. He was born not alive. But then my daughter, the problem now is I have this active route where, my body is open, everything is ready. What the fear is if we did nothing, she would end up getting a severe infection and I could die. So I'm having to answer these questions. What do we do knowing that he is born? Your body is at a route for infection and she is not.
My goodness.
And I mean, blessedly, not blessedly, my body said, "You have to deliver. This is the safest thing for you." So
Mhm.
she, who had nothing wrong, nothing going on, was literally just in the situation, she then delivered. And of course, this happens in the middle of the night. Of course, this happens at like 2 AM, and
Mhm.
she's born alive. And so I'm able to hold both my children, one alive, and I was able to hold her until she died, and the other one still. Blessedly, the nurses took pictures. I was so overwhelmed. I wasn't able to process that, even though I knew the process. I lived in the process, but I was the patient then.
Right.
So was in pure shock, pure overwhelmment, and they took pictures for me. I was able to keep them in my room, and then the next day, I left that hospital I worked at and had to start this life over alone in my home.
My goodness. I'm truly sorry that that happened to you, sir. What you've described in regards to the loss is something that me and other lost moms can relate to. Just shock and not being able to process, and the moment not really feeling like a moment, like, is this actually happening to me, right? But as a someone who has the medical knowledge, did that perhaps complicate your own grief journey in the days and the weeks to come?
Absolutely. The hardest part was it's like you know too much.
Yeah.
And for me, even the 10 hours after, or not even 10, 4 hours after. So I delivered my babies in the middle of the night. I woke up the next morning. I feel like I have to perform the lack of grief because in the medical arena, we are we're going from happiest of happiest to most sad of sad, so it's almost like you feel like you have to have a level of separation, and they teach you to do that, which is I have a hard time with because and I think that this is part of why I do what I do, because this separating ourselves isn't helping, it's hurting. But where it's ingrained into you, they teach you this way because they feel like this is the barrier that allows you to mentally stay sharp and do what you need to do. And I think that's the thought process, but I had learned one way and now I was living the other side. So the next morning when I woke up, I still have my children, like the amniotic fluid on me. I'm one with my children that are no longer alive and are now in the morgue and in this hospital I'm at. But I'm still someone that works in that hospital. I'm still there with the people I work with all day. These are my colleagues. So I wake up, I go to the shower, there's no soap. I use my badge and I go to the auxiliary room and get everything because I don't want to be in imposition. I don't want my grief and what's going on to me to be uncomfortable for the people I work with. I take a shower and rinse, my children, the last bits of my babies off of me, and then I have to keep it together as I'm wheeled out of the hospital and no, and I'm thinking about how uncomfortable I'm making my colleagues
Yeah.
because I know their thought processes and them seeing me leave as a patient in this situation. And then, I have this knowledge of how they think about people in the hospital when they act certain ways or do certain ways. So I was on my best behavior to be a good patient, a tight, a plus patient. And I was internally just suppressing my grief from minute one to make other people feel okay.
Yeah.
And it was because of my medical mindset that I was doing that. And I was putting myself always, again, last because I needed to make everything else okay for everyone else.
That's tough. What was the hardest part of the days and the weeks that came after you lost that people don't often talk about?
I think well, the number one thing is the silence. I
Yes.
think when I got home and the initial home, you think about when you go home from the hospital of having a baby that there's going to be, I don't know, you just have this vision of noise and full and laughter and much.
Yes.
And I went home and the silence was almost deafening. It
Mm.
felt like it was ricocheting off the walls.
Yeah.
And it was it was a hard piece. That initial silence was hard, and then the days after were the undoing of the being pregnant. So the things that had been building and people knew, but obviously not everyone knew I went into the hospital and delivered or that I had an early delivery and I don't have my baby. So I'm still getting like the next day, the Pottery Barn catalog came in because that was still a big thing then. As soon as you were pregnant, they knew it and they started sending you everything you needed for your registry. So it said like, "Congratulations, you're over halfway through your pregnancy. Let's register." And I saw that, lost it.
Yeah.
The first time you go into, like, the supermarket that you go into all the time, so you may and everyone has seen you. They had, they'd seen me pregnant. I'm again 4'11", so even at 22 weeks, I looked 40 weeks pregnant. So they started asking you questions about, the babies and having to tell strangers
Yeah.
and try not to make them feel uncomfortable. And that was the thing I kept coming up again is I was always minimizing my feelings for others. And so I think those were the two, the unraveling that didn't magically happen when I got home and
Yeah.
the silence around it.
Yeah. Both of those are tough.
Mhm.
The reminders of what was in those periods, they like come one after another. I know the losing it moment for me was to see the medical bills return and not have anything to show for that birth and delivery.
I actually, speaking of the 2 days after I got home, I guess the hospital miscoded me, which again, this is where I work, and
Yeah.
they called to check in to see how the babies were doing.
My goodness.
And it was the first time I had to say out loud, "They're dead."
Yeah.
And it was, it was that lack of continuity. And then I got a bill for the nursery. And I was like, I didn't use the nursery. And having to fight a bill for, I mean, you have no energy and then you're
Yeah.
fighting a bill.
Yes. It's the toughest thing.
Yeah.
This thing.
And the people you're talking to, you feel like they're robots.
Yeah.
You're like, "My baby died and didn't go to the nursery," and there's no like, "I'm sorry, da da da." It was just like, "Well, we have a bill for it." And I'm like, "Cool."
Yeah. It breaks my heart to think about those moments. What
And
kind
how many women feel it?
Absolutely. It's so common that it's sad
Mhm.
that, the compassionate care, whether it's with the practitioner, the people on the phone that are making the calls to follow up, they're just doing their job, right? But why not have some compassionate care in the moment?
Yeah. Like,
Because
it's hard, like,
what kind of impact you're making on the person on the other side of the line.
no, I went in, because I wanted I had an autopsy done on my son.
Hmm.
And while I was back at the hospital, and that's a whole nother story, but while I was already back at the hospital, I was waiting for the autopsy to come in. So I went down to medical records to be like, "Hey, what's going on with it?" And she was like, "Well, it's here, but it's like 75 cents a page. Do you even want to pay that much?" And she was like interrogating me on if I wanted to pay the cost to get the autopsy for my child. And I was telling her, "This is the autopsy for my child." So I was actually wearing my white coat with my doctor stuff on it, saying I was a doctor in the hospital she was talking to. And when this conversation was over, I was so broken by it because there was no compassion. I actually said, I was like, "Hey, I'm a physician here and like I'm asking for the support and this is what you're saying. So I don't know how you act to everybody else. But
Right.
when someone comes in and says that they want the autopsy information for their child, I hope you could take a second and bring your heart to this conversation because that's one of the hardest conversations they're having with you that day."
Right. To even formulate the words to ask for the autopsy.
Yes, like,
Energy. That's
yeah.
energy.
That was the hardest thing I had done. I had to work myself up to going down there, and to be dismissed was heartbreaking, and I'll carry that forever.
Yeah, yeah. On the opposite end of the spectrum, what kind of support in this during this time was most meaningful to you?
So the support that I found most meaningful was connecting with people who have been through similar experiences.
Yes.
Um, it took a lot for me to go to a support group because I didn't think that was something that I was good at. But when I finally went and I brought my husband along because, you feel grief different ways. And I
Mhm.
was feeling it a certain way. And we went in and I felt like other women were speaking the words that had come out of my mouth and that had come from my heart. And I couldn't speak because I was crying the whole time, but hearing them say my feelings broke me open
Yeah.
because that aloneness, that isolation, and I lost my babies in 2013. So there wasn't as much online space as there blessedly is now. But
Right.
the days after, I had scoured the internet looking for people with stories like me. I
Mhm.
didn't want to feel alone. And so
Yeah.
when I went into a room and heard that over and over, it broke me open in the right way. I felt like there wasn't something wrong with me for feeling the way I felt, even though other people outside who had never experienced this couldn't comprehend how broken I was because they had never met or felt those my children. I knew my babies. I had lost someone that was the most powerful part of me, literally a part of me. And even though they had never met them, they didn't know them. It didn't mean it wasn't the hardest thing that would ever happen to me. And
Right.
hearing other women feel that way, I felt like there wasn't anything wrong with me for having so much despair over this.
It's a way of being seen and
Yes.
understood when
Yes.
somebody else verbalize what you don't even yet have the words around. It's like, oh my God, it's an eye opener to not being alone, which is why we in our nonprofit advocate for people to attend our support group because it creates the actual safe space that you need to talk about this. Your encounter at the hospital with getting that autopsy, that's the way that most of the world who hasn't gone through this sees that.
Mhm.
It's isolating to try and express those feelings and emotions again, and exhausting. So, yeah, support groups create safe spaces that help with the healing, and I'm glad you and your husband were able to experience that journey.
Well, and from someone who didn't think I would be comfortable in a sport group, which is why I didn't go at first.
Me too. Me too.
Yeah.
I was such a private person before I experienced those miscarriages, and I was just like you. I was listening to the other women share the stories, and that gave me a voice around it.
Yes.
So, it sounds like that, you don't have a problem talking about what you went through. And the reason that I don't either anymore, because I know that if I tell my story for somebody who can't verbalize it, it's a way of feeling seen. So I'll do it 1,000 times over. Fortunately, it doesn't hurt for me to share anymore because I know that I'm now helping. But yeah, verbalizing when someone can't, it's next level in the healing journey.
And even when it does still hurt, it's like hurting in a way that's helping break you open. Like it's not the hurting of suppression, the hurting of putting it down, the hurting of stuffing it down into the place you feel like it belongs. It's the hurting of opening and allowing something to feel. So sometimes I tell my story and I feel like I can tell it and I'm okay. Sometimes I tell my story and I feel like I'm literally right back in that moment.
Mhm.
And both are okay for me now because they're both powerful parts of this because I always tell people I'll never be over losing my children.
Right.
I'm just the roller coaster's just leveling out a little bit more. I
Good.
mean, there are weeks where, I have certain times of the year, especially where I feel like I'm going up that roller coaster, about to hit the part where it really escalates. And I know now because I have been open with my story, because I have talked with other women, that that's okay and that's normal and that's forever and that is okay as well.
Absolutely. What has life after loss taught you about hope, resilience, and moving forward?
It's taught me how well, specifically, it taught me that grief is just love, that my grief, my heart is just love. And that initial grief, that brokenness, is that feeling of love where you feel like you don't know where to put it.
Mhm.
And
Mhm.
it's and that has been really eye-opening to me. And feeling the stages of grief. I am not an I'm never no one ever considered me an angry person, but during grief, I had anger and it made people uncomfortable being around me. And it ends up being a lot of like shame on yourself for feeling a certain way. And it allowed me as a physician to see that anger when someone brought anger to me and not feel it at me, but feel it around me and feeling me as something that I should hold back for them.
Yeah.
And so it was a real teaching. And I hated when people told me this loss was going to make me a better doctor. I
Yeah.
hated that,
Yeah.
but it's actually true. And I hate that. And I hope I would have rather been a worse doctor and had my babies. And I tell people that all the time. But the grief broke something in me and the having to work through this process and love myself in this process and love others during this process taught me a lot about what people were bringing to me.
Yeah. It's like seeing the world with a different set of lenses.
Yes.
For us that are not practitioners, like, because I've gone through this grief, I can see that grief in someone else's eyes, and I know how to move appropriately in a accordingly to be there for them.
Yes.
So it's an awkward place to be in, and you never want those words spoken to you, even though they're the truth, because of the awkwardness of, reliving the experience, but now knowing how I can serve the person in front of me better.
No, absolutely.
Yeah,
And
it's a
but I want I want people to know that there's something about like the forever love for your child that and you get to personally be the only one possibly that ever knew that love.
yeah,
It's a powerful thing. You own something inside of you. You are and will forever be their mother. And that's special. And not giving up on that and not feeling like you have to pretend they don't exist. And that's a hard thing too. Like when someone asks you how many children you have, do
yeah.
you tell them about your children and make them uncomfortable? Or do you
Loaded question.
Yeah. Yeah.
They're just trying to ask a simple question, and, if you're transparent, it's gonna be more than what they ask for.
Yeah. And it's like, how do you honor them without making the world feel uncomfortable? And I said, screw it. Like that's their fault, not mine. And that might be a growing space for them, a way to ask that question. But I usually answer with I have 4 children and 2 on earth. And then
Mm,
I try to like let it where I can move on because
that's a great response.
I don't want to take away what is like real for me. Like I have 4 children. I've had 4 children. I birthed 4 children. Whatever way it happened, that is what happened to me.
That is the reality.
Mhm.
Absolutely. So if you could change one thing about how healthcare providers, families, or society supports parents after pregnancy loss, what would it be?
This one's a little bit personal, and so I know it won't hit everyone, but I wanna number one thing would be how healthcare takes care of its own, how
Yeah,
we treat those within the system, and how we care for those within the system. Because if we are actually if the word is health care, but we don't actually care about the people, even the people within the system, that's a broken promise. And I don't want to be part of a broken promise. I want healthcare to be about the caring part, not just the health.
absolutely.
So
And
that would what I put
just described, you would have received so much love and support in the moment at the hospital when that happened to you from your coworkers. That's how it should have been.
well,
Not having to save face in front of them.
well, even when I went back, the testing to see if I was really back, I had to prove, and I actually said this, I was like, so you need me to prove to you after I had this horrible thing that I am okay to be here. And one of the things they did to test me was have me deliver twins that they knew were going to die and then tell the parents. And that was supposed to be the attending's job, but they wanted to see if I could handle it.
My goodness.
And that was the most broken thing I had ever seen because I had actually set a boundary. I had gone to a therapist that helped me say, here are your boundaries at work because you're going back into the place of your trauma.
Yeah.
You have to work there. So set the boundaries that are safe for you, and that shouldn't be a problem. And my boundaries had been I'm not ready to deliver twins, and I can't go back into the room I delivered in. Those were the two that I put out, and I didn't think that was a lot. I knew
No,
how to deliver twins. Like this was not a problem. So I didn't think it was necessary that I had to prove it over and over because that was something I dealt with throughout my career. I was third year then, almost out. And not going into the one room in this system because it was going to cause I was told that that was ridiculous. I was told that wouldn't fly. And that's why the testing happened to me. And I mean, I did it. And then blessedly, the other residents I worked with felt ashamed that that happened. So they covered for me when I went and took 2 hours to
yes.
cry because I wasn't in a safe space to care for others after that. And that wasn't fair.
Yeah.
But they felt like that was an important test they needed to prove.
My goodness.
And that's the
Yeah.
healthcare system. And that's why, again, why I do what I do.
Thank you. Thank you for sharing and thank you for doing what you do. So, for the parent listening right now who may have experienced a recent loss and feels completely overwhelmed, what would you want them to know today in this moment?
That you are not alone. The overwhelm is there. If you can find a group to talk with, like this is your group, Jamilah, your group, an easy way. And it shouldn't be a hard thing for you. You shouldn't have to do the work, but Be in that group, listen, open, because it's going to help so much. No matter if you're a sharer or not, it's going to help so much. And make your boundaries and support your boundaries. It
That's
is okay to say, I'm not ready to do this. And don't feel bad that you're not on someone else's timeline because they don't, they're not living in your body. They're not dealing with what you're dealing with.
that's perfect. Where can people learn more about your work and connect with you?
Well, I have a website, www.selfority.com, and that's where kind of the meat of what I do is, but I am very active on social media. I am too old for TikTok, but I think I'm going to have to get on it. I'm on Instagram, Facebook, LinkedIn, and I write a ton. So I actually write for Katie Couric. I've written for a couple other news articles, and I have a Substack and I write constantly on there. And that's where I'm most personal and I have more open with my stories. So it's on Substack, it's Dr. Sarah Berg. You can find me there. But what I do, just to clarify, is I bring education and advocacy. I'm not clinically practicing right now to make space for this. And I bring this education in a way that hopefully feels accessible and entertaining and where you feel like you have an ask. This will be the first time I say it out loud. I'm actually going to be starting a podcast where I do exactly that. It's basically
Let's go.
it's basically saying this is how you can bring your question to your doctor and really have a fruitful conversation because I know from both sides it's complicated and I want to make the easy button for you guys because that's really why I stepped away from practice so that I could give you guys what I have been through and emotionally know, but also what I've seen from thousands of you. So this isn't really just personally my story. This is all of our story.
I love that. I'm excited for you.
Thank
Please
you.
keep in touch and share those details once you've produced your podcast.
Yeah.
Gonna help and serve a lot of women. So
I
thank
hope so. Like, that's why, again, this is why I do it. Like, I care so much about women's health and advocating for all these women that I have seen and haven't seen because I know what's out there. That
yes.
what little thing I have to give, I want to give.
Thank you for giving your time today and sharing your story with us. I'm excited about the things you've got going on professionally, and I'm really looking forward to that podcast.
Awesome. Thank you for bringing me on and thank you for giving me the space to share about my babies, Hunter and Brooke.
No problem. Absolutely. Thank you all for tuning in and continue to listen and stay tuned for future episodes of our Life After Loss series. Goodbye.